Welcome to part 2 of module 2, wheelchair service provision best practices, considerations for telehealth. As we discussed in part 1, the ROSNA Wheelchair Service Provision Guide provides a framework for steps in provision of wheelchairs, and these modules focus on the considerations for telehealth. In module 1, we focused on referral, assessment, equipment recommendations, and selection. In part 2, we will focus on funding and procurement, product preparation, fitting, training, and delivery, follow-up, maintenance, and repair, and outcome measurement. In regard to funding, procurement, and product preparation, telehealth does not significantly affect these processes, so standard best practices are recommended. Fitting, training, and delivery do have aspects that would be different if done via telehealth. For fitting, you would need to take items to the consumer's home or remote environment. This might include tools or other items specific to the device to specifically fit and set up the device. Similar to assessment, setup of a device for telehealth visit is key so that audio and video are in an area that allows remote team members to visualize the fitting. For training and delivery, similar to assessment, this can be particularly useful as the team can see the consumer interact with their own environment and make adjustments as needed to the fitting and setup of the device. For follow-up, maintenance, and repair, these can all be done in some aspects remotely. If your team is planning to do follow-up maintenance or repair remotely, there should be a plan for either telehealth aspects with an app or consumer-facing module, or for a phone call to do troubleshooting with someone for maintenance or repair. For outcome measurement, an established plan should be determined ahead of time for obtaining outcome information. If it's typically collected in the clinic, determine if the patient or consumer portal, a phone call, or a telehealth visit is appropriate means to collect the information. And remember that outcome measurement priorities vary for different stakeholders, as discussed in Module 1, so different ways of collecting information might be necessary. Next up is Module 3, Etiquette and Logistics.